And it's showing us that since 2000, we're comparing like for the last 5 years, and we've realized that even for some conditions, the increase is just too much. So as we shall see subsequently as I break down the different issues that are in here. But we realize that generally there's an increase in mental health cases, and that is affecting, these are now people with real mental illness who require treatment. So meaning that they're putting a burden on the health system. They're putting a burden on quite a number of even families, because once someone has a mental illness, then it means they cannot perform very well, or they are using a lot of their money into treating this person. And remember, mental illnesses usually take on a chronic mode, like someone is not going to get better after 1 or 2 weeks. It's like a long-term thing, and some people even have it's lifelong for some of the people. So that becomes a very important thing. If we do not pay attention to it, then we find that it will erode a lot of, the fabric, the social fabric, and, we shall not be performing as we're supposed to perform, productivity in that case. Then, of course, we realize that there are quite a number of socioeconomic drivers for these conditions. It's around it's centered around, the economy, the way economy is moving, and also the way our society is being or is managing issues, or is changing over time. Because you can see that there's been a lot of urbanization wherever you go, even in villages places which used to be villages. You find there are some towns that are formed, and people have left their rural part of that village and come into the urban part. And of course, we know that life in cities is not the best for most of the people, especially when you're not working, when you're just doing very little work, or work that is not, they are not engaged in gainful businesses. Someone gets just lukumi, and then they are coming into town, they have to rent, they have to, and most of the time they just do things that are not what they're actually supposed to, but just mediocre. Like someone has like a house which is not worth living in, even in some places.
They do what they can to survive.
They do what they can to survive. Exactly, that is well said. And then there's also other issues that we found, the life course issues. Like if someone, people having issues across the whole life course. The children, as you have heard, there's quite a lot of mental health problems amongst the children. But what we are mostly worried about during that time is that whatever happens, whatever adversities, whatever problems that happen during childhood, then they're going to be reflected as mental health problems later in life. We realize that people who have lived in abject poverty, people who have lived in abusive relationship, not lived but grew up in abusive relationships, people who have separated from parents, those who are having divorces and so on, children who are living in such families, or those that are fighting, or those that are using drugs, we find that later in life, these are children who are most likely to develop mental health problems in life. So, and yet these are things that are very common. And of course, when we get into adulthood or even teenage life, you see there are quite a number of issues amongst the teens. And we are hearing quite a number of suicides among young people, and issues where those of us who are on the other side, like who are older, we could not even have thought about such an issue to cause you to, lose a life. Someone says I hasn't given a book, I was forced to go into class X and yet I wanted class Y. Those are some of the things that children are having issues with, and affecting them to a level that someone can even kill themselves. So there are some issues that are happening during it. Amongst the adolescents, that is affecting, their mental health, and of course the country's mental health generally. Then, of course, now when it comes to the elderly, we are seeing quite a number of the elderly who are having issues, the loneliness that is happening in there. We have left them in the communities, not caring for them at all, Excuse me, sorry about this. We've left them at home, and they're staying alone. And sometimes we are putting our children, their grandchildren, and leaving them with them, and yet we're not even supporting them. You can imagine a mother taking care of, and a 65-year-old or a 75-year-old taking care of a child who is maybe 2 or 3 years, and yet they do not even have the support. They don't have soap, they don't have sugar, they don't have the things that they would have loved to give such a child. But, but because the mother is gone somewhere to work, or the father is not even there, those kinds of things. So there's a bit of, what can I say, like stress,
breakdown of the family
stress.
system?
Yes, there's first of all that is there. There's breakdown of the family system, but the stress they're putting on the elderly. Instead, elderly life is supposed to be, resting and so on, but we are giving them, more work, and yet it is not. We are not supporting them to do that work. So it is causing problems amongst that age group. So there's a life course. There's a way life is affecting. I mean, there's a way mental health is affecting each and every one, depending on where they are.
Different population segment.
Different, exactly.
All right, let's now look at the statistics.
Yeah.
What kind of statistics do you have in this particular report?
Okay, so this report actually found that there's quite a lot that is happening, and you cannot put a finger on just one thing. There are so many things that are intertwined. And the first thing that rose our attention, or that brought us to a lot of thinking, was the fact that 73% of the population is actually aged 30 years and below. Look at all your 30-year-olds or 25 and 20, olds. Most of these people are continuing to stay in their fathers and in their parents' homes. So meaning they're dependent. Some of them have continued to be in university. Some of them, even after the first course of bachelor's, they will go for master's because they've not found anything to do. They are not married. The girls are not married. The boys cannot even afford to be anywhere, So these people are actually dependent. Now, they are dependent on a smaller section because at 60 years, you're retired. You're retired in public service, for instance. So you can imagine if you're 60, then you have a 30-year-old and, all the line of all your children are still under your care. And yet, in the past, these children were supposed to be working. I mean, once you finish university, 23 years, you're supposed to get into some gainful business, and then you start, earning and making your family and going on. And then you start
your parents.
Exactly, you start supporting your parents, as it were. But these days, it's the other way around. The parents have continued to support children even past university life. So now you imagine 73% of the population is actually being fed or being managed by a very small section, because remember, I think it's about 5 or 16% of the people who are now managing, because there's a certain section amongst the adults who are not working and cannot, and actually are also being supported by this small section, those that are aged between now 31 to 60. That's a very small group, and that's the one that is holding the whole burden of the whole country.
So we are looking at unemployment as a contributing factor.
Yes, so this is one of the statistics. It's not now that's the next one, unemployment. There's just having a very big burden of people who you're supporting as a person. Those that are supporting a very big number of people. Then two, there's unemployment. These youth actually are supposed to be employed, but it has been found that most of them actually have not yet gotten into gainful business, have not been employed, yet they're having skills. The other thing that was worrying to us was the fact that the high fertility rate of 4.5 children per woman. That means that many of these children, remember, they are between 30, you start counting the fertility at 15. Someone can start delivering at 15 years. So until they become 49 or 50 for that matter, for most of the people, they can even get into 50 and they can continue to have children. So that number means that we are producing even more. That is a tap that is opening. And I remember my minister was joking and saying that every year we add 2 million people onto the population. And you can imagine the last time we did a census, we were 43? So in the next following year, you're going to be 46. And you'll be 46 because very few people are dying. We are no longer dying. We have a higher life expectancy, and yet we have a high fertility rate, meaning that many people are actually living, but the quality of life that many people are living is quite poor. And that is also another reason why we get worried, because if quality of life is poor for the many people, then it means the general population is not doing very well. I mean, our quality of life remains so poor. So those are issues, those are statistics that put us at a very funny rate. But also, we realize that the mental illnesses also increased. I've already alluded to this. This is another statistic. And there's a certain condition like depression, called depression.
Depression.
Kwenyamira in Uganda. It rose by 240 from 2021 to 2025, meaning that there are so many
240%
of the people. I mean, we got more cases like those that we're reporting within our facilities. That's a big number.
What is driving this depression? What do you think is happening?
There's so much that is driving us, just like I already alluded. Yes, but because just to be brief, there are life events, things like loss. There's been a lot of loss of in terms of death, but also financial. You can imagine some people you've had shops that have closed, you've had things that have been destroyed, for instance, just here in Kampala. But there's quite a lot of financial loss, There's a lot of theft, people are stealing each other, someone's shop is raided and it's and sometimes even they are killed along the way. You've heard of those border things that have been happening. There's quite a bit of violence. There's a lot of violence leading to death and also to financial losses. So that alone causes a lot of tension. Even if it hasn't come to you, the fact that you know that it's happening around you, then you'd fear, you would not live very well. But also their physical health. We know that there's been an increase in NCDs, non-communicable diseases. If you just asked around what was the cause of death of the last person you buried, you'll hear that most of it was diabetes, hypertension, cancer, road traffic accidents, these non-communicable diseases that are not passed on by whatever. So that physical health, there's quite a lot of it happening. You're saying, why are we seeing this? There's a lot of these things that are happening. And once you get pressure, once you're given a diagnosis of cancer, of course, your mental health will not remain the same. You'll get worried. You'll start wondering where you get the money. You'll start wondering, you'll start even thinking about death. There are those things that we've always known. There's no clear treatment for cancers. For most of the people who get it, usually pass on. And, so you cannot know what your journey will look like. We've seen that people who there's a lot of depression amongst people who are having those chronic illnesses. But there are people who are born with some traits, personality traits. People with poor coping skills. If you cannot manage, many people cry over so many small things. Someone cries, someone has low self-esteem. They don't feel they are good enough. They're human enough. They feel they are second-class citizens somewhere. So such a person cannot be developmental. They will be worrying all the time. They cannot fit in any office. They cannot fit in any place wherever they go. Even if it's a lumbe at home, they will be kept somewhere behind. They will keep behind, and that alone, there's a way it affects your mental health.
So someone would be right to say that majority of Ugandans are depressed.
Yes, that is right, and we have found this. Many people are depressed, and the funny part about depression is that it happens in different levels. There's the low, mild, and severe, and for those that we see in facilities, it's usually the severe one where someone is really now gone totally. But most of us are living with the signs and symptoms of depression, which include sadness, severe sadness for most of the time. You're worrying about certain things. Of course, we've seen the losses and all those things that worry us, the financial, the children not working, those things. So there's a lot of worrying. Then there is a poor sleep. Then there's poor appetite. And all these are happening to us. And it is for most of the time. Today you may go out and be happy with your friends, but when you go home, then it comes to you. Like you are alone now and it is on you. You start feeling that heaviness. So many of us are actually depressed, and we certainly need to do something. And I'm glad this population, the National Planning Authority came up with the population report saying that mental health is now an emerging crisis which we need to look at, and just beyond a health issue, but a developmental issue. Yes.
Right. Let's look at the developmental side. Like you said, it's a developmental issue. I was looking at some of the statistics that come from the report. There are also, consequences, including impact in terms of the economy, the losses that we are making because of this high mental health burden in our country. What does the report say about that particular issue?
Okay, so There's quite a lot that they're talking about the economics, but we're looking at it. I think I can divide it into like 3 parts. And the first part is looking at those that have jobs. So when you have a job and you're working fruitfully and you're innovative, you do a little more than what you're supposed to do, then you'll get more profits. The company will get more profits, and they will, you will be earning a little more than you'd have earned, if you didn't do anything. But we are seeing a situation where someone is unwell, they've not slept well. The moment they get into office, they start to doze, or they cannot think. Their mind is really back and thinking about those bad things that have happened to them, the violence that has happened in the home, the losses that have happened, the children and so on that I've already alluded to. So meaning there's a lot of presentism. We call it presentism. Someone just comes to work. They just sit there. They may not do anything. They will not innovate. They will not try out new things. They will not do anything. So that one is affecting us so negatively, and especially for those jobs where if you do a little more, then you earn more. For the health, for the public service, where like you're paid at the end of the month, it means that most of the work that you are supposed to have done is going to accumulate. You'll not do it. For most of the time, you have not done the work. So, and you don't meet the deadlines and so on. So things somehow stall. So you're not working. That is one. 2, there's what we call the disability adjusted years. So when you're having a mental health problem, you're not living normally. You cannot perform to the maximum. So meaning you're living a life which is not to the maximum. It is not to what you would have wanted to live, So meaning that you will not enjoy life, as it were. You will not enjoy life. If you have depression, you're so lonely, you're so alone, you're crying most of the time. If you have anxiety, you're just up there. You're just you cannot be there when you're fearing every other moment. You can even fear your own shadow, like there's someone coming for you, and that kind of thing. And that's anxiety. That's how it happens. Your heart is racing. You can't think. You can't do anything. You can't even sleep. You will not even eat very well. So people having very poor quality of life is a developmental issue. You cannot work. You cannot perform. Then the other thing is around and the treatments that have to happen. You can imagine if you're treating one person with a mental illness, it takes on a lot of, it takes a big toll. Most of the mental health medicines are actually expensive, and that's the reason why sometimes they're not even in our facilities, because they'll drain all the budget for the other medicines. So most of the time, people with mental illnesses will go without the medication, and those who manage to buy the medicines, they have to dig deep into their pockets, and many times they'll have to ask for support from neighbors, from friends, and so on, and other family members. So that alone means that when you work, instead of paying school fees, instead of doing so many other things, you'll be looking for money to do the treatment, or to help someone go for care in another facility somewhere. So those are very serious economic consequences, and especially when you're so many of you who are sick. I mean, it can happen if you're just 1 or 2, but you can find that every other person, when you look into a family, every other person will need this support. And for most of the time, lately at least, many people are no longer getting the support that they're actually looking for, they sought out for, because everyone is having issues. The other one is having cancer, the other one is managing a sick parent, the other one is there are so many things that we are dealing with. And so we cannot develop when we are having such things which are not resolved.
All right. Spectrum on Radio 1.